Good morning, everyone. This is Tim Henry, SCAI president. And for the October President's Message, I've invited Dr. Lyndon Box and Dr. Joaquin Cigarroa, who are both on the SCAI Government Relations Committee co-chairs, to talk about what they've been up to. So welcome, Lyndon, Joaquin, welcome.
Thanks for having us here.
Yeah, pleasure to be here.
So the Government Relations Committee and the SCAI PAC seem to me to have a new drive and intensity. So tell us what's happening in Washington related to interventional cardiology. Lyndon?
No, I think that's true. Do want to start by saying that SCAI is the Interventional Cardiology Society, and for that reason, we're the only organization looking out for the specific interest of interventional cardiologists. And that's something I want all of our members to be aware of. As part of that, we're focused on three main issues that I think affect all of us in our practice. First, we're fighting all of the 4 Medicare cuts to interventional cardiology that we may be facing for 2022. We want to reform prior authorization, especially the Medicare Advantage program, which has been really difficult for us to work with around procedures. We're tired of fighting insurance companies, and we're going to try to get Congress to fix it if CMS won't. And we have already got over 200 members of Congress listening. Third, we support the Amputation Reduction and Compassion Act. We believe that's going to reduce the number of patient amputations due to peripheral artery disease. And of course, the Medicare cuts I just mentioned is going to be devastating to this population because it would directly affect reimbursement for outpatient peripheral artery disease procedures.
Joaquin?
So as chair of the DEI task force, we are keenly supportive of SCAI's work on peripheral arterial disease. The disproportionate number of minority patients who suffer from vascular health concerns is truly disheartening. Fortunately, we have people within SCAI, such as Dr. Faluso Faccaretti, who's been a leader here. In addition, our committee, the GR committee, is keenly aware of the issues facing our younger interventional cardiologists. In parts of our country, the volume of procedures has tripled because of the COVID-19 backlog, and this creates a real risk of burnout amongst our staff. We know that eventually this crisis will slow and that our early career interventionalists will still have substantial amounts of student debt. That is not a good combination. And for this reason, SCAI is supporting the READY Act to help alleviate medical student debt. So we also work with other SCAI committees. For example, we worked with Dr. Audrey Marshall from the Congenital Heart Disease Council, who presented on why the Accelerating Kids Act is so important. It will, if passed, allow for the treatment of pediatric patients as they age into adulthood in the Medicaid program and allow an individual in one state who needs access to expertise, potentially in other states, to get care.
So that is an impressive list. And I think that's really why we wanted to do this month, because I really think people really need to understand the extent of what's happening. So let's drill down. Let's start first let's drill down on the Medicare cuts you've mentioned. Lyndon?
Yeah, this is going to be a huge fight looking at 2022 because there's actually 4 different possible cuts that we're facing that may add up to about $40 billion total. It's going to be especially hard for those that are still in private practice and those who have independent facilities like office-based labs. They're going to be proposing a cut in the clinical labor pricing. This is going to affect supply and demand equipment pricing reimbursement. And then we also know that they need to update the rate for the clinical labor formula, but we're really trying to push that back. And then there's going to be direct practice expense costs probably increased by about $3.5 billion across the country. The other thing that's coming up is budget neutrality constraints are expected to reduce the conversion factor by another $3.3 billion. And this is going to limit access to care for our Medicare patients, force patients more into facility-based systems, and that's going to be actually a higher cost.
Wow, you guys sound like Thelma and Louise. So this sounds to me like potentially we're heading towards a cliff.
Right, and on top of all that, there's also the PAYGO cuts that are coming up. So that's going to be another issue that we have to fight.
So,
Joaquin?
we're talking about, issues, that are occurring now and, between now and the 1st of January. The difference for us is that we can tell Congress and we can tell CMS to hit the brakes. We have had tremendous past successes. And for example, this year alone, we helped postpone $3.2 billion in cuts that were planned for 2021.
And 2020 was challenging, but as we said, we did have our success, and some of that was due to other societies chipping in, but a large part of that was due to the efforts of SCAI, and really appreciate the SCAI member support. Our list of accomplishments is actually pretty long for 2020, so I brought a slide here to show some of what we did. And as Joaquin said, the #1 success was SCAI pressed Congress to abandon the CMS proposed physician cuts of $3.2 billion that would have gone into effect for 2021.
So we can all have this and take a look at this slide, and then this will be available to you too. I think we'll send it to you, send it out, because it is an impressive list of what really got accomplished last year, and people should be aware of it.
And the other thing that the Government Relations Committee is promoting is more interaction and direct contact with members of Congress. I want the members of SCAI to know that we are engaged and focused on interventional cardiology. Back in April, we did a virtual fly-in to talk to congressmen and senators. And one of the more exciting things that came out of that, Dr. Andrew Goldswig invited Senator Deborah Fisher from Nebraska to come visit his hospital and his cath lab. And she took him up on it. And actually, here's a picture of her touring the facility back in July.
Yeah, and I think everyone should pay attention to this, because this is from my perspective, this is how members of Congress actually understand. And, we know the incredible importance of heart disease, but actually getting people out there to see what we do on a daily basis is really important. And I love this thing with Andy, because I think this is the way we actually can increase awareness. So what else can SCAI members do? What's available on the website?
So one of the most powerful things you can do is actually take part in our grassroots campaign. We've had Dr. Dipali 2K out visiting with all of our committees and councils, getting the word out about the grassroots action campaign and how to access that on the website, which is pretty easy. Basically, the website has all the grassroots campaigns that we have going on. Recently, we had the Bear Bashan letter to the House leadership, which is an effort to stop the Medicare cuts. There was another Rush Brelakis Dear Colleague letter focusing on the labor pricing costs, and then the PAYGO cuts and other sequester-related cuts. We have grassroots efforts on all of those. So you can go to the website, pick a campaign. We hope you'll do it for all of them, and write directly to your member of Congress with a pre-formatted letter. And it honestly takes 20 or 30 seconds to send a letter to your congressman.
Yeah, and it's critically important. So finally, Joaquin, can you talk briefly about SCAI PAC?
Sure. So, before talking about SCAI PAC, I also want to make sure that our membership knows that we're working with coalitions, including the AMA, other special societies, the USPA, and the ACC in an effort to advocate on behalf of our interventional cardiologists, staff, and our patients. And, I'll look towards Lyndon to talk a little bit about SCAI PAC.
So yeah, I think the thing with SCAI PAC is we found that if we really want to connect with representatives and senators, we need to have a chance to talk to them and tell our story. And what the PAC is basically independent of SCAI, because SCAI member dues cannot go to campaign contributions. And this allows, the SCAI PAC allows us to make campaign contributions to senators and representatives and get a chance to meet with them and talk to them about what we do and what are the issues that are facing us, like all of these cuts that we've been talking about on the call previously. We've had a lot of successful meetings. Here, just wanted to show you a few of the meetings that we've had along the way so far. We've met with Representative Fred Upton, who's been very helpful in the Medicare cuts fight and has signed on to the letter, Bear Bashan letter that we mentioned above. We've also met with Representative Mike Burgess, who's a doctor and very much understands our issues, and especially those issues facing our private practice interventional cardiologists that are trying to survive. We met with Raul Ruiz, who is also a doctor. He's been very helpful with the campaigns. And also Representative Karen Bass, Bobby Rush, Ron Wyden, Chairman of the Senate Finance Committee, and Senator Bill Cassidy.
Yeah, that's outstanding. So let's summarize. So number one, go to the website, write your member of Congress to help prevent Medicare cuts. It's really important that we have a widespread participation. Number two, if you're a SCAI member and a U.S. citizen, donate to SCAI PAC because it really does make a difference. Number three, you can receive text messages about both SCAI PAC and SCAI government relation activities, including grassroots messages to send to your congressional representatives, and you just text SCAI advocacy to 50457. And then finally, talk to the SCAI government relations staff if you have any need, and we'll help you. We need people to be involved. And I want to really mention Curtis Rooney, who's done a fantastic job in terms of our government relations. And as I think people can see here, we are doing a lot, and we're doing it to help SCAI members and to help our patients. And so you can make a difference and help us.